today we're having this joint webinar, which we're pretty excited about, having both the ByrdAdatto presence with Mr. Adatto of the ByrdAdatto here, and then obviously the Shorr solutions, and both of those Shorrs, the dynamic duo, as we reference you in the podcast. But I think today's gonna be a good time for us to spend some time from the legal perspective, and then obviously outside the legal perspective, all across the board of ways to discuss what's going on, what are we hearing, what are we seeing. I mean, right before we joined, we were already bantering about certain things, and obviously hopefully answer some questions, give some information, and then near the end, I know people obviously know Zoom now. It seems like they can drop chat box stuff in, and as questions come up, obviously we'll try to address them each time. But those not familiar, ByrdAdatto is a national boutique firm. We are based in Dallas and Chicago. 100% what we do is business law, but of our clientele, more than 75% fall in the healthcare industry. And of that, the vast majority are in the aesthetic market, plastic surgeons, dermatologists, med spas, ambulatory surgery centers. So we have a lot of leeway of learning stuff from our clients and then hopefully teaching them some aspects of the law side. So that's who we are. Mara or Jay, you want to introduce yourself?
Sure. So I'll take this one. So we are Shorr Solutions, or we are, I should say, the partners in Shorr Solutions, the partners of Shorr Solutions. We have an amazing team that supports us and could not do what we do without them, but we are practice management consultants. I am Mara Shorr, one of two partners, and the other, who, depending on where your screen is at, could be down here or over here, is Jay Shorr. And Jay is not only my business partner and our founder of Shorr Solutions, but Jay is also my dad. So yes, family first. We always like to do a big hug. So because of COVID, I haven't seen him in a while in person, but although we are based in Florida, we have clients across the country. And quite honestly, we not only focus in the cosmetic aesthetic industry in this medical space, but we are seeing more and more issues every single day coming up, really related to COVID, related to different pieces of legislature, things that we have never seen before in our industry. And so I would say on a weekly basis for probably almost a year now, Jay or I are reaching out to a member of ByrdAdatto. And when we knew that there was going to be an administration change, and we're not getting into the politics of this, but we knew that there would be some new policies, or even just the timing of this all, we said, let's make sure that, once we're settled into February, we knew months ago that things were going to be different. So that's where the idea for this webinar came about. We do have some very specific questions. I'm going to be the one asking the questions of these two fine gentlemen that we have carefully curated. They are our most frequently asked questions that, quite honestly, both Brad, Jay, I, and our team, that we get all the time. So we've curated some of these FAQs. I will say that if you have additional FAQs, this is your time to ask the experts. So like Brad said, put them in the chat box. But one of the things I think we want to get started with is, for a quick second, we're going to talk and just dive right in to employees of your practices. So the cosmetic medical space, employees in medical practices, and the mandating of vaccines. Now that we know the majority of our clients have already been vaccinated, have received their second dose, Jay, do you want to kick us off with some of the questions that we're getting and how we're responding when it comes to mandating that an employee gets a vaccine now that they are eligible? And let's talk between you and Brad, let's talk about how we're responding to that.
Well, there are a couple of components to that. The first component are essential workers and first responders. And as a disclaimer, I just got my first shot vaccine for the 65 and older group. All right. I am thrilled to death. I'm now waiting 2 more weeks from today to get my second shot, which will allow me the comfort, at least, still not becoming reckless, but the comfort to once again travel, to once again do things that in the past year I have chosen not to do. And I'm not basing judgment on any of you out there that don't agree with how I've chosen to live. All right. That's an individual decision. But the questions that we get all the time stem from three things. Number one, do I have to, and should I treat a patient who has not had a vaccine? Number one. Number two, can I or should I mandate that my employees get a vaccine? And number three, what are the existing rules behind the FMLA, FFCRA? We can get into paycheck protection programs and forgiveness later on, but I do know that in accordance with the federal government, the FMLA rules ended in December. It can be optional if you want, but I say don't be discriminatory. All right. If you're going to do it for one, you do it for all, and it could be tax credits until the end of this first quarter. Now, the reason that we've titled this, New President, New Year, is because when the new year came out, there are new laws that weren't the same as they were last year. And every time when we call ByrdAdatto, it is, well, if you're calling at 9 o'clock, I'll give you an answer, but why don't you call me back at 4 o'clock? And maybe the government has changed that law. So we've kept pretty much abreast of the law, basically with the CDC, the NIH, Department of Labor, the SBA. It is so encompassing. And I share with you that I read SBA, I read all these laws for a hobby.
For fun.
I even downloaded a copy of the Constitution. I know how boring that is, because when everyone starts talking to me about Article 1, Section this, Article 2, Section this, I really want to know for it myself. So I want to open it up to Brad, our go-to expert attorney. And let's start it off with patients. Can we refuse to see a patient if they have not had a vaccine? And then we'll follow that up with, can I mandate that an employee gets a vaccine, or that they have to stay home from work if they have not, because many choose not to, if they've had exposure?
So let's take that one piece at a time. I know we threw a bunch
got
at
it.
you, Brad.
Yeah, I like the way you hit me with a multi-part question, but start in the beginning. I like it, Mara. So, first off, yes, but. So yes, and you can refuse to treat a patient if they have not been vaccinated. That is a choice that you can make, especially in the aesthetic world. Where the but part is, or the and part, however you want to say it, if you're in another industry where you're in the process of continuing to treat someone, so post-surgical, or in a treatment process that needs 3 or 4 aspects of it to be fully completed, that's not the time to say, well, unless you get vaccinated, I'm not allowing you to come back into my office, because there's a lot of patient abandonment issues that you can run into over a course of a treatment. The scope is 5 procedures or 6 procedures, or the post-care of a surgery, especially, and you refuse to see that patient because they have not been vaccinated, that could be a problem. So again, vast majority of the time, especially in the aesthetic space, you do have the opportunity to say no to any patient. But the moment you start treating that patient, you have to be very careful as to when and how you terminate them. I would not recommend that be a policy in the sense of you would only treat those who have been vaccinated, because at this time you're going to have a very small number of people who can come through your front door. But again, it's your business, and how you choose to run that business is up to you. And then going to the part of is, as Jay, you were saying, just because someone has been vaccinated doesn't mean that you drop all your guards. You still should be very careful, because it's although 95% effective for some vaccines or other vaccines at different levels, you as the provider still need to make sure that that you as a provider aren't violating your own medical or nursing board rules, meaning that although the patient may have been vaccinated, there may be still a rule in your state that says you, the treating provider, still have to have a mask or a shield, depending on your state and depending on the procedure. So be very careful as more and more of your patients come to the door that may have been vaccinated, that you don't drop your guard, even if you feel safe doing it, that you would not be then perceived to be providing medical services outside the standard of care. So that's kind of the first part of your I think your question, Jay, as far as that patient walking to the door. And And then obviously, Mara or Jay, I don't know if you have any add-ons to that first piece.
I think that that's something that we're honestly going to be looking at as an industry, what could be when it comes to refusing a patient if they haven't had the vaccine. I think that's going to be something as an industry that we're looking at more heavily 6 months, 8 months from now, maybe more towards the end of the year. Brad, just like you said, most people aren't even eligible right now. So I tell people that they ask, and I think everybody certainly has their own personal choices, which is the next question we're going to get to. But as a young-ish, healthy woman in her late 30s that works remotely from home, and we don't have children in school right now, so we are not eligible and won't be for quite some time. So I think when you get into somebody, the majority of the population right now is still not eligible. But when you have your essential workers and when your employees are eligible, I think that the majority of our clients at this point have been vaccinated, but each practice does have some employees that have elected to withhold for the moment as far as getting the vaccine. So let's talk a little bit about what happens when an employee that is eligible to receive the vaccine chooses not to. Let's talk about any mandates that employers can or can't legally put into place.
So for starters, there's guidance that the EOC, or Equal Employment Opportunity Commission, issued a long time ago in 2009 as it relates to vaccination, especially with flu, was what they laid the groundwork as far as mandating healthcare workers be vaccinated, which then also rolled into you as employers having certain requirements of vaccinations for somebody even to work for you in general. So in generally speaking, on a high level, as an employer, you can mandate that your employees be vaccinated. Of course, we're not saying that that's our answer, because there's a whole bunch of ands and exceptions to what I'm about to explain. And then just throwing out the federal government rules, there are a lot of states already that have certain vaccination rules in place if you are working in the hospital systems. I know just off the top of my head, California, Colorado, Nebraska, Massachusetts, New Hampshire, New York, and Rhode Island, I think Tennessee, all are states that already have that in place as a state. If you happen to be wanting to have hospital privileges, the hospital can require you to be vaccinated. So again, that goes to the next level. So it's not just the federal government that says you can mandate it. Some states says you must be vaccinated. So that's the next thing. So then you start getting into people saying, well, what if I really don't want to get vaccinated, and I, as an employee, I don't believe in it, I don't want to do it. Can I say no?
Or if you have an employee that is not in the hospital, if you have an employee that is, an administrative position, for example, that will never set foot in that hospital.
Sure. And so first off, as a mandate piece, any employer, so let me be very clear. We have state law issues that have to come into play, but any employer can mandate that their employees are vaccinated, period. Full stop. It doesn't matter if you're in the healthcare sector or non-healthcare sector. So we at our law firm, if we wanted to make sure every single person was vaccinated, we could have a whole list. And we definitely are at this point recommending people start looking over, if they don't have one, developing a vaccination policy, because we definitely think that's going to be something to protect you as an employer down the road. Because if you don't have a vaccination policy, and this is, we'll get into the discrimination issues in a second, but you're opening yourself up to lawsuits down the road.
Okay, so let me back that up with a scenario, because here in Florida, and I know I just heard in Los Angeles County yesterday that the supply was less than the demand. So now, as an employer, you are requesting and requiring that they get vaccinated, and the person who really doesn't want to get vaccinated doesn't tell you they don't want to get vaccinated. They just use the excuse that I'm in that category that I cannot get vaccinated yet because I'm younger. I happen to not qualify for the over 75 and essential worker first responder, but I did qualify for the over 65. That's how I was able to get in. But somebody that's young and healthy could say to you, even though you're requiring to get vaccinated, I can't get a vaccine yet. How long can that go on? And then I have a scenario that was a true life scenario that happened yesterday from a patient.
Sure. So the first question is, obviously you can't make someone to do something if they can't get it. So although I know in many situations, even here in Dallas, Texas, where people my age are starting, they're getting phone calls from the hospital saying, hey, we have, if you can come in today, you signed up, come in. So it's happening because because of the temperature and the use, and that they have to use them. So they have basically a dialing number where they're trying to get rid of vaccinations when people don't show up on time or they don't show up at all.
Correct.
And so that's happening. But your answer right now, I think, as an employer, if you're saying you must get vaccinated and the person wouldn't qualify, I think you're on shaky grounds to say, well, I terminated because they didn't get vaccinated when they physically couldn't do it. Now, going back to your excuse part, Jay, let's fast forward to in May or June, when at that point you can go to CVS and get it done, or Walgreens or Walmart, and get the one-shot wonder. At that point, the question then goes back, do they have that same excuse? Probably not. So then let's go to what they can do. So those individuals with certain disabilities, and these are certain defined by the Americans with Disability Act, they could, and it's not exhaustive, and I don't have every single one of them, but they could be precluded from actually getting it because of some pre-existing condition in which they can't get vaccinated. So that's your first, well, there goes the lights. I guess it's over, guys. That's the first one in which they could say, hey, pause, because I qualify, I can't get this vaccine. Therefore, you as an employer can't force them to do it, although there's an exception to that, because there's always an exception to exception. The second one is if it's a sincerely held religious belief. And so I had to really remember that particular one, because it's not just, it's against my religion, it's sincerely held. So there's been a whole bunch of case law on this particular piece. So it's not just like one day you woke up and it's your newfound religion. They want some oomph behind it. In fact, there are federal courts that just say, well, I'm against vaccination, and therefore that's my religious belief. Actually, a federal court has said that's not sufficient. And so again, going back to, those are your two outliers, which is if it's a disability issue consistent with the ADA or a sincerely held religious belief. But let me give the exception to the exception. If you're an individual who's a frontline person, medical provider. So again, this is going to switch gears on you going back into the medical industry, and that you may have a particular vulnerable population that you work with. So think of your retirement communities or certain in the OR and stuff like that, nursing homes. An employer can mandate that you get vaccinated. And if you fail to do so because of disability or religious belief, and they cannot accommodate you. So this is your job. You have to be here. You'll be in a room, or you'll be in a facility where we have a population that is subjected to this, and you refuse to do it, they can terminate you. So there's a long list of exceptions to exceptions, and maybe, I don't know, I do have some clients in the nursing industry, so we have talked to them about that, although the vast majority of our clients don't fall in that category. But so for most of our clients, it is still an option for them to consider it. We have yet to have one of our clients outright mandated where they have to do it. So I don't have that scenario. Maybe, Jay, you do with your story you're about to give. But the other follow-up question I always get when we start talking about this is, do I have to pay for it? And it's a great question, because now you as an employer, so a lot of them do already have certain benefits. So the benefit plan may already be paying for it. So it's not that big of a deal. Other places that don't have significant benefits, and I'm sure y'all read this, like Dollar General or Trader Joe's, what they said is, hey, if you want to get vaccinated, we'd love for you to do it, and we will pay you time off. So we'll give you up to 4 hours to go and get vaccinated, or give you a stipend for doing it. But again, it's up to you. We're not mandating it, because you're out there in the general public, and we feel like we want to protect you, our employees. So those are the ways. Go ahead.
At that angle, Brad, is it against HIPAA or any sort of regulations to then require proof of vaccination if an employer gave that person time off? Is it are they allowed to then turn around and say, but you must produce
Yes.
a photo of your vaccine card, for instance?
Yes, and you're allowed to do that because that goes back to there are certain things as an employer you're allowed to request of an individual depending on your employment. So if you have a vaccination policy, just like those of us who have kids, we know that we have to every year show up and show that our kid's been vaccinated, and or the same thing for a workplace, same thing for, obviously to prove that you're a citizenship. There's a lot of things, or a green card, that you as an employer are allowed to ask for, does not breach privacy issues. But great
So
question.
I want to actually switch gears for a second because we have another issue that has continued to come up again and again. Jay, I know we've run into this issue quite a bit with our clients, but also just we see this and in speaking with other colleagues, we're hearing this a lot. So there are certain employees, and it becomes more of an issue when the employees are unvaccinated or when the majority of their families, those in their immediate circle, are unvaccinated. So when you have employees that routinely put themselves in situations where they are coming in contact with those that have COVID, they might be able to, it might be that the situation is out of their control. They have children that are in school, for instance, and that is just the situation. We've also seen situations where you have an employee that every couple of weeks they're going to a large gathering, they're going to the mall, they're going to a wedding, etc. So Jay, do you want to talk a little bit about how we've handled and had some of those discussions, and then have Brad discuss that as well?
Sure. I call it the increased exposure. All right.
Yes.
And we're not here to mandate whether or not and how you explain to your employees what they can and they can't do. However, when there is known exposure, all right, then we have expressed that you have to follow CDC and NIH guidelines. And I don't really care what somebody's opinion is, because it used to be the 14-day rule, then it went to the 10-day rule, and then how many days that you have post potential exposure to quarantine where there is no fever and you are unmedicated and no symptoms. You become asymptomatic again to mitigate the potential of bringing the exposure back into the workplace. Brad, if you could touch on that when there is a known exposure, somebody brings it to your knowledge that they believe they were with somebody that when they were exposed to it, what the requirement is for the employer to tell the employee. Many times the employee doesn't want to hear it. They're angry they even brought it up because now they've either exhausted their PTO. FMLA is now over as of December 31st. The employer may, at its option, use it till the end of the first quarter of 21 and use it as a tax credit, but don't have to. And to be non-discriminatory, has chosen not to. So therefore, now the employee has zero PTO left. They don't want to take time off. And we're abiding. My advice to them is to abide by CDC and NIH. I've had many conversations with Texas Workforce. I've had Texas Department of Health, and they've referred me strictly to the COVID hotline in the Texas Department of Health. Could you want to expound on that a little bit?
Yeah, I think there's two different things happening here, and I'll start with the exposure piece and then jump into how you as an employer work. And I think this is maybe, Mara, where you were starting with, is a lot of our employers have said, clients say, hey, I know that Sally on Facebook is doing such and such, or I know that they're doing this. I want to tell them they can't do that. Well, be careful, because depending on your state, a lot of states have laws in place that so long as it's lawful, again, lawful is a strong word, but lawful, you can't prevent them from doing something when they're off duty. So that's the first one. So like California, New York, Illinois, I know off the top of my head, definitely have those in place. Now, of course, now let's go to what Jay was talking about, which is, okay, but now I know they were at something. They most likely were exposed somehow. So what should I do? Well, the first thing is already in place. You should already have your policies in place as to social distancing, wearing masks, everything that you can do already to prevent the spread inside of your facility, taking temperatures or whatever it is that you have in place. So that's the very first frontline defense, so that if someone does have it, that you can at least have that ability to say they were never in proximity of each other for longer than 15 minutes at a certain time frame. So again, going back to, we want to try to protect the individuals. The next piece is it's strange because both the CDC, which is just guidelines, no enforcement arm, just guidelines, and many states have guidelines but no enforcement. Now, some states are starting ad enforcement with penalties without wearing a mask or other things. But you as an employer, what is your exposure? I think that's what you're getting at the heart of it, Jay, which is, I know that Sally's been doing something. She's coming in and she may or may not have been exposed. What should I do? And so again, the very first thing is, I'm trying to limit my liability as an employer, that number one, I don't have somebody come in and be patient zero of my firm or my business, in which that person becomes a spreader inside of it, because what is my liability? Now, there are a lot of states are playing catch up to this, where they're saying, you as an employer, if you have certain things in place, social distancing, following CDC guidelines, we don't think you should have any liability if it turns out one employee gave it to another employee. So let's go back to, I know that she's not following the rules. She's not wearing a mask and she's visiting and sitting too close to someone else. And I don't enforce the rule. A lot of states are saying, well, that's on you now, versus it's on, you don't get the liability protection because you weren't following the CDC guidelines and you weren't following whatever, or your state guidelines. What do I do with someone though who's out of PTO, or they're a person who because they potentially were exposed? What can I do with that person? Well, some employers are allowing those individuals, again, this is depending on your state and at will, to then basically take a leave of absence unpaid. So that's one of the things that we're seeing people do. And then other people are trying to accommodate them as best they can if they can work from home. That's always great if that person is the back office person, but if they're a frontline nurse injector, that makes it impossible for them to be, working from home. So it starts really becoming the accommodation of that particular individual. It's hard conversation to have with a lot of your employees because they may have already used up all their PTO, but you have to be, unfortunately, an advocate for your other employees and protect them. And so as someone who daughter brought COVID into our house for Christmas and gave it to my wife and I, which was a lot of fun way to spend a Christmas. COVID for Christmas is always awesome, by the way.
That is the worst Christmas present to give, FYI. I would not recommend it. Well, I haven't had it, but I understand it is not a highly recommended. You must have done something to anger Santa last year.
Obviously, it was not coal in my stocking. I got COVID. But the point is, as soon as I found out that my daughter had it, I knew that our policy is that we had a quarantine at our house, because I didn't want, if I was exposed, which I ended up being exposed, I didn't want to bring it back to the office. And that meant I had to clear my schedule. I mean, there's a lot of things that happened but I had to do what was best for my employees. Unfortunately, we've had one of my partners is home right now because his daughter has COVID. So he's out for the next, and again, it depends on your state. Certain states are now saying 10 days versus 14. Certain schools are even shifting, saying, if you go get a negative test and it meets this particular standard, your kid can come back. So again, there's a lot of different things that are, as Jay, you said in the very beginning, the CDC keeps changing their rules, the states keep changing their rules, and the rules right now is this A, the rule by the end of the day is B, and that's the part where I know as employers and as my clients get frustrated, because as soon as we issue one opinion as to what to do, that can change very quickly. So it is a time in which we all have to have a lot more patience than we're used to. But unfortunately, we have to have those hard conversations and confront those individuals to protect the others.
Okay, so now brings up the requirement or lack of asking and requesting that a patient either tests or be tested before you will allow them to be treated. Hence, allow me to share an example. There was a issue with one of our clients. who sent us that they received a negative review on a Google review online. The review goes as follows, and I'm saying it as in the top of my head, that the patient alleges, or prospective patient alleges, that they went to make an appointment and that the doctor said they need proof of a negative COVID test. And here is the name of a pharmacy that we use that is inexpensive, or you may go to the testing place of your choice. As it was, the prospective patient got upset, irate, and wrote a review saying that the doctor has a kickback with the pharmacy that he's requesting that he get this test with, although our client gave the patient the option. The other part was that the inflammatory part is he wrote that it looks like our client is a NASA astronaut because he wears a spacesuit. You know, it's one of those helmets with reverse airflow, right? A tank on the back. I happen to think that's complimentary. He says it looks ridiculous in there. He'll never go back. He found a place, the patient found a place that didn't require the test. He was able to get at a military base a test that was 72 hours, 4 days old. The doctor refused it. Could you share the requirement of refusing to treat the patient if they refuse to go and give you a current, what can be current COVID test?
That's a tough one because, as you know, at the rapid test, there are certain places that don't consider that to be consistent because of the testing model that goes into it. I know, my partner, Jeff Siegel, who's a doctor, he's more of a mad scientist than anything else. He's explained to me in very as simple as terms as possible the difference between the rapid test and the 48-hour test. And all I can tell you is he sounds really smart when he says it, but I still don't know the difference. But the major difference is the 15-minute test still is not accepted by most places. And so if you are going to go get, if this doctor is saying the rapid's not good enough for me, I want to have the 48-hour test that has all these other parameters to it, you're still talking about 48 hours. And so my clients or this particular individual, I advise them, great, 48 hours ago, this patient did not have it. You need to treat every single patient as they could have it and have the same protocols, whether or not they have been tested or not tested, because the test could give you a false belief or it could be false. It could say that they don't have it. And that's because it just hasn't gestated long enough, because sometimes it takes 4 to 5 days before you can get a positive test. So the point is that I wouldn't hang all that on saying I feel so much better now that I know that every patient that comes through here is negative, because that, again, the testing of that is not sufficient.
All right.
I think the other question, Jay, that we get a lot, though, is should I be testing these patients myself before they come in with the rapid test? That's a tougher one. Only the reason why I say that is, do you want to be in the process of being testing for people and then start giving them false positives?
No.
Good. Right.
I do not agree.
Same answer I give my clients who've asked that question.
Right. Do you know why your partner, Dr. Jeff Siegel, sounds smart?
Besides being a neurosurgeon?
No, because he is smart.
I was waiting. I said, Jay's going somewhere with this. Where is Jay going?
Yeah, I know Dr. Jeff Siegel, the neurosurgeon attorney. I know him. Jeff is a very interesting man to speak with. He is very smart.
Yes, he is.
I just enjoy speaking with him because everything that comes out of his mouth, I just sit there and, the old favorite expression is you're never an interruption of anybody's time when you have something interesting to say, right?
Well, definitely. I think, as we hit on the majority, and if not all, of the points that we wanted to cover, if not necessarily, I think some of them were slightly incorporated into other parts of the conversation. We talked about CDC, we talked about ADA and FMLA, et cetera. Brad, did you have something?
I did want to add something too.
Yes, please.
Which is about the second or third part of when Jay was talking about the employees. I wanted to get back into that piece. The only other piece I wanted to go back into about the enforcement piece that I was talking about, again, we have to be very careful about enforcing the rules. And so again, if you do decide to build out a policy, which you should have, you need to be consistent as to how you apply it in a non-discriminatory fashion. And so that again, you can't also one day decide someone doing something off duty over there is a problem, but someone doing something over there is not a problem. Whatever it is, the policy you come up with, first off, be consistent. Try not to jump to conclusions, because again, just because you see something on Facebook or LinkedIn does not mean it really happened the way you perceived it to happen. And then this goes back to probably where we should have started, at least I should have started the whole conversation, is just because you believe your employees understand the policies or understand the risk doesn't mean they do. And so it's a constant evolution of, you may have educated them back in March of last year on why we have these policies, but a lot has happened since then. People feel more relaxed or more accepting or more terrified. Everyone has different ways in what they're looking at it. And so your job as the employer is to continually try to find the time to educate them. I think it's a very important aspect. And as your policies shift and change, make sure you don't just email it to them. You spend the time and effort walking them through why this is important to you as an employer, but more importantly to the entire team who you're trying to protect.
Good.
And why it's important to the patients. I think that's incredibly important too. And I think that something you hit on say, that makes a lot of sense in reality too, is that just because you see something on social media, if it doesn't mean that it's reality. I even know internally, I got a call a couple months ago from my mother-in-law wanting to know, she thought that my husband and I were being so careful. And then her twin sister, my aunt, sees something on Facebook and it's me with this group of people. It looks like I'm at a baby shower and with 7-8 people, and I'm not being careful. The baby shower that I was at in that photo, that baby is in kindergarten. So it's just, we're talking, there was no COVID at that point. So I think there is something that something might be missed, but lines are truly blurred. And there is such a point, we know as employers that what the case was in March was not the same as it was in April or May or August, et cetera, et cetera. And there will be changes that continue to come. And one of the reasons that we included new year, new COVID rules, new COVID laws, new president is that, again, we're not looking at which political party, but we know that there will continue to be changes in legislature. Just it will continue to evolve. There will be different rules and regulations and legislature surrounding the vaccines. There will be different legislature surrounding funding for your practice and PPP. And the important part is to make sure that you as a practice owner are staying, or as a practice manager, whichever role you might be, you're really staying on top of it, or at least connecting with folks like whether it's Shorr Solutions or ByrdAdatto that are staying on top of it. Because even if you came in a few minutes late, you missed it. Not everybody is like Jay that literally downloads and reads the Constitution for fun. You missed that in the first few minutes if you joined us a little late. That is truly what Jay does. So, but we need people like that. So there is a lot that's going to continue to change in the coming weeks and the coming months throughout the rest of 2021. And Jay, what do you anticipate possibly coming down the pike in using your crystal ball?
Well, I don't ever like to use a crystal ball. All right. But I like to make two comments and then close with PPP, which is a really interesting thing for many, many businesses. Brad mentioned about, being clear, concise, consistent in your approach. Don't be discriminatory. I hate to say this, but we all have favorite employees. My favorite employee is Mara. Her favorite employee is me. All my employees are my favorites. However, seriously, in a medical practice, there may be favorites, and you've got to take that equation out of it, because you have to be non-discriminatory. And I always like to take the politics out of it, because I promise you, no matter how many people you have in your workplace, there are going to be diverse diametrically opposed opinions politically. And I don't believe that one person's going to say that the vaccine was a hoax. Another one's going to say, no, it's for real. And I don't want to get into the middle of this at all. I'm just saying that the rules are the rules regardless of how you feel. And that's why when you have these discussions, ensure clear understanding and don't assume, as Brad says, that people understand it, because Mara and I have a favorite expression, and it's what I said is not what you heard, even though they were identical words. So the interpretation of one person to another, ensure clear understanding. And if you have a policy, make sure that that policy is in writing. I urge you, there's nothing ever wrong with, if you want to have your policies, have it vetted by a law firm to ensure that what you're saying is correct and it's not going to come out and get you in the end. It will cost you more to have your law firm represent you in a case than it was to make sure you were correct from the beginning. Now, in closing, the payroll protection program, which is part of this new year, new president, whatever, we're trying to get this all wrapped up. We have gotten our forgiveness for our first round PPP. And we just got approved today for our second round PPP, and it will be funded by the end of today or tomorrow. Now, the reason for that is I was on top of this from the very, very beginning. And yes, it did have its online hiccups. I got rejected 3 or 4 times because the Department of Labor changed their rules about you having to sign your profit and loss statement or whatever documentation. It wasn't in the first part of the second round. So now you have to date it and sign it and make sure your name is on it, because it got rejected, because out of my QuickBooks, it didn't have my name. So it got rejected again. So seriously, folks, for free, I will talk to you if you call me and say, hey, this is what I need. What are the things I need, to prevent me from getting it rejected and rejected? And the only reason I say this is because if it's done and it's too late and they run out of money, if there is a round 3, you may have to wait till round 3 because the money will go fast. So I urge you, don't put off asking for the forgiveness on the first round. The quicker you get it in, the faster the monkey is off of your back. And the quicker that you respond to it, what you need, here's the rules. A 25% reduction in any quarter of 2020 versus 19, or an overall 25% reduction in your gross 2020 versus 19. That's rule number 1, qualification. Rule number 2 is you had to use all of your PPP round 1 money if you got it. It could have been 60% for payroll and then 40% for your other expenses. And then when you're figuring it out, it's not as easy and simplified as people think, because there was a caveat that was not posted unless you dug deep. It is your gross payroll wages minus any monies that you may have taken in FFCRA, FMLA tax credits. So you have to deduct that from the gross, and any monies in excess of $100,000 per employee. That gives you now a gross SBA. You had your gross payroll minus your $100,000 per employee minus your FFCRA and FMLA, which gives you your gross SBA. Now you can add in your 401 IRA, dental health contributions, add in your federal state taxes that you had as an employer match. That then gives you a total. Pause, divide that by 12, pause, multiply that by 2.5, and that is what your allowable is. For being part of the ByrdAdatto and Shorr Solutions podcast webinar, I am more than happy to give you 2 spreadsheets I have created that are Excel-based and formulas. I'm not asking for anything in return other than write to us as a courtesy from ByrdAdatto and Shorr Solutions.
And I'm going to put our email address in the comments in the chat box. So
All right.
check the chat box. We're info@shorrsolutions.com. I'm going to put it in the chat box right now.
All you have to do is fill in the numbers, and the spreadsheets that I created will give you the number, and hopefully it matches from your payroll report, and it will match your 941s that you submitted to the federal government. It really sounds complicated. It's not, and I'm here to answer any questions that you might have.
Real quick, as we are wrapping up, does anybody have any additional questions? I want to give everybody just a minute or two, put them in the chat box. If you do have any additional questions, anything that we didn't cover, I know we went through a lot. I do encourage you that we each have podcast series, webinars, videos. We have both ByrdAdatto and Shorr Solutions. We have been in the trenches, both separately and quite honestly, a lot together. We've done a lot of joint content. And so I encourage you, Brad and his business partner, Michael, which is the Byrd of ByrdAdatto. They have Legal 123s, which is their podcast. We have Shorr Solutions, the podcast. We are not as creative when it comes to branding as the folks at ByrdAdatto. So Shorr Solutions, the podcast, we keep it simple. And on our website, we have a whole section of videos and everything. So I really encourage you, and this is not to self-promote, but we have had so many people ask so many questions. There are episodes on each of our podcasts where we're collaborating and we're talking with each other. So I truly encourage you. That's a great place to start. And if you have other questions, the best way to contact us is info@shorrsolutions.com, because that email address goes to both Jay and I. Brad, what is the best way to get a hold of you if somebody is not necessarily a client yet and wants to, email you, chat,
Sure.
talk about life?
Couple of things. Number one is our podcast is now just got dropped into the thanks to Riley. So if you want to listen to the podcast that we did with Mara and Jay, that was just dropped in there. And then
thank you, Riley.
And then Riley can drop in info@ByrdAdatto.com will be the easiest way to reach out. And there it is for if y'all have questions. And I think in the last few minutes, I know that we have left. There's two things that Jay talked about, or three things I just wanted to kind of refresh on. Number one, Jay, I prefer the Magic 8-Ball because I think that gives a lot more insight to what's going on personally. Number two, I'm so happy that you put together those spreadsheets because I was told to be no math today, and that sounded like a lot of math to me. So I'm glad that you've taken care of that. So I'll be reaching out to you later for that.
There's no math. You just fill in the block and it calculates everything.
I know. This is why I'm happy. I don't have to do math. You did all the equations.
Everybody needs a J. Numbers, although I appreciate the data, I love interpreting the data. Jay, I always joke, he has this brilliant, beautiful numbers brain, and it takes him longer to explain how he got a number than it does for it to just compute in his melon. So I see it all the time.
Perfectly fair assessment. So thank you for that. And I think the third thing that we didn't talk about at all today, and I definitely feel like a lot of our clients have reached out to us because they're trying to figure these things out. And we could probably do a 45 minutes on this subject alone, is just understanding telemedicine or telehealth. And my comment I have to every single person on this is, look, it's changing by the hour. I mean, every single morning I'm reading about a new state introducing new laws on how to work with telehealth rules. It goes back to one of the good things, if you can say anything good that happens when you can't see patients on a day-to-day basis, is there really are states who've been sitting on their hands forever and not really thinking about how should a physician and patient interact via telemedicine, and what are the requirements we as a medical board feel or nursing board feels the most sufficient way that they're getting the care they need based on whatever that service is. So for the first time in ever, and I've been speaking on this subject for over a decade, I'm really seeing a huge shift. Now that makes our life, as Jay was saying, a lot more interesting because states are constantly evolving as to what has to be, oh yes, this service over here is fine via telemedicine, but this one's not. And again, sometimes, unfortunately, the person who's coming up with a decision is a person who's never practiced medicine in their life. So I'll have a doctor saying there's no difference between procedure A and B. In fact, B is actually easier to perform. Why does that one have to be in person, but A does not? And I'll say that's because your state legislator does not understand the difference between the two. So don't assume just because one thing works, the other one doesn't. Unfortunately, the state of Arizona, I have an open case right now in that case where they assumed, unfortunately, that they were good to go because they were doing it in another state the same way. And Arizona said, no, we believe what you're doing with those hormone replacements, that you cannot do it without an in-person meeting beforehand. So again, every state's going to be different. Don't assume each state's going to be the same. Slow down if you decide to use telemedicine, and make sure you understand your state rules. And more importantly, where also the patient is located, because both come into play. But that's the thing that it's fascinating how many calls I've had on just telemedicine alone.
Okay, so question for the legal eagle on the telemedicine, and this has come up. Knowing that the performance of telemedicine is that you've got to be able to be licensed in the state that you are practicing telemedicine in, what happens if you have a patient that is in your state, travels out of state, does a telemedicine visit with you, and now you are practicing that telemedicine with a patient that is calling you from out of state, and hence you're now practicing medicine with somebody that is out of state, even though they are your patient in state?
So some states, a great question, Jay, do have exceptions to that. If you had a pre-existing relationship with that patient is on vacation, summering, wherever, but they still are a resident of your state, even though they're out of state, because of that pre-existing relationship, and it's not the first encounter, you're allowed to continue to help them, whatever their needs or follow-ups or whatever it is that you have to handle that individual. I always caution people is, then if that person then permanently moves that state, it's after 12 months, if you had not, again, seen that person in your state or treated that person, it starts becoming a little bit fuzzier. Most states had this rule for a long time, is that you had to have seen the patient in person first, and then you could start doing telemedicine only for a certain limited time frame. Again, every little state's a little bit different, but go back to that 12-month window. A lot of states have thrown that, seen the patient first. It's, hey, you can see that person, you can treat that person via telemedicine, but you have to meet the same standard of care as if they walked into your office. So as I've told other docs, if you physically have to lay hands on that individual to determine if that patient's a good candidate for that treatment you're about to do, can't do it via telehealth. But if it's, no, I can use a phone, I can see it if they have a phone and look at the skin or whatever it is, I would not have to physically touch that person. Great. But again, you have to remember what is the standard of care. And then, as you said, Jay, the periodic ones, I don't have a massive hiccup on, because it's the technical, it's the long-term ones, which starts becoming more problematic.
Muse, not this one right back. Her.
Get a little closer. Get a little closer.
Well, thank you, everybody. Thank you for joining us today. Thank you to all of our attendees. Again, we have our contact information. All of our email addresses are in the chat. And so you are able to find us those places via email. You can find Brad's website, more about his firm, at ByrdAdatto.com. You can find out more about Shorr Solutions at, yes, ShorrSolutions.com. Make sure that's Shorr Solutions plural, because as we say, and we joke all the time, we have more than one. And honestly, if you have any questions, we are happy to provide a 30-minute free consult. I know Brad is always incredibly very generous. I know a lot of you are probably working with him already, but if you aren't, ByrdAdatto is one of our preferred go-to healthcare attorney law firms, because this is what they do day in and day out. So we refer clients back and forth all the time. We work really well together. So if you have any questions, it is a lot easier. It is a lot less expensive to bring in an expert from the start than to try and fix it later. I can say this from experience, but
Promise you that.
Yes, but thank you everybody for joining us. And Brad and Jay, thank you for allowing me to kind of guide this conversation today. And Brad, thank you for allowing us to be part of the conversation.
Yeah, it was a lot of fun, guys. I always enjoy spending time with you.
All right. Thanks so much.
Bye, everybody.